With you that most people don't want to talk about this. I had to convince my producer to make us have this conversation on this program. King Charles just got diagnosed.
This morning. I heard that this morning.
And has been, very open about, his screening for prostate and what have you. But cancer is perhaps the most expensive disease to treat. My mother-in-law died of stage 4 cancer, a few years ago. And I understand, I saw firsthand the pain that they go through. And I also saw the loopholes in our health system. It's like you just leave them to die. And then they had to tell us to go get some drugs that we can't even access, from the counter. What do you think is the problem here? Is it that we are not prioritizing it in that sense of it, or we don't seem to have, quality healthcare? Because I'm also concerned about the practitioners. It's like maybe you doctors have seen too many people die that you've lost your sense of care for them in the real sense of it.
That's not a very charitable thing to say.
It is what I've seen firsthand, right?
So
I have seen doctors.
Very charitable.
I have seen doctors in government, government hospital. They don't even look at the person in tears, in pain. They just walk past you and say, and just leave it to your fate.
Well, it doesn't mean they're not devoted and they're not committed to their job. So I have to say something. People don't realize, doctors get a lot of stake, and I don't mean just doctors. Doctors, nurses, and healthcare providers get a lot of stake. But if roles were reversed and you actually worked in the circumstances these people worked, you probably won't show up to work. But these guys show up to work every day, crisp, sharp, dedicated, motivated.
You don't want to know what other people are going through.
I understand. People have bad experience. Look, there are bad experiences. I'm a doctor in Nigeria. I know these stories. There's nothing you're going to say now that is new to me. I understand what the problems are. And to be fair to the government, considering cancer care, they've really, really tried in the past 4 years with the NSI Youth Cancer Center. You have to be fair. But that is not enough. It's just one center. And the center cannot cater to all of Nigerians. You have people coming in from all over Nigeria and even the West African sub-region to the NSI Youth Cancer Center. And even the workers are getting burnt out. It's a lot. No center should have to deal with those numbers. But we're doing a pretty good job. It doesn't mean that, not positive stuff isn't happening. You have to talk about the positives and the negatives. Now, the negatives, yes, there's a lot of issues with financing. People have issues with financing. If someone can't pay for the medication, can't pay for the investigations, what do? You're stuck. That's a unique position to work out of. And in other countries, they just put it on the computer and they send healthcare insurance, covers it, and they just move forward. But Nigerian doctors have to cajole the patients, have to help, and sometimes actually have to finance these things for the patients. But nobody really talks about that. So I think it's just really complex, and it's not so easy to just point out one thing and say that's the cause.
So let's try